Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learned from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia.
Welcome to Destination Medicine. I'm Nicole Goodman. As a little boy being driven through the country towns of Queensland by his parents, Dr. Patrick Dwyer dreamed of living the regional lifestyle. And he's achieved it. By way of city training in Brisbane and placements throughout Central Queensland, he's spent the last decade working in his chosen specialty, radiation oncology, at Lismore Base Hospital. He says it's the one-on-one patient contact, the opportunity to assist individuals through their treatment journey that has attracted him to this specialty. And he's giving back by initiating a successful move to turn Lismore into a radiation oncology training hospital. He starts by telling Jeff Waters about his path to medicine.
I'm a Queenslander. I grew up in Brisbane, went throughout school in Queensland. And always my interests were in anatomy and the human body and science and physiology. So I always had an interest in science and biomedical sciences. We used to go on holidays as a family throughout Queensland, a lot of regional towns there, and I'd often look at the little regional hospitals and wonder what it'd be like to work there. So I wonder, looking back now, if that sort of seed was planted in terms of practicing medicine, and especially in a regional centre. I did some work experience throughout high school in the hospital, both with doctors and allied health staff. That sparked my interest even further in pursuing a medical career.
Did your parents have anything to do with it?
Well, my mother was a nurse, father's an engineer, no doctors through the family. So, I suppose I was influenced by my mother being a nurse, but no direct medical connections in the family, no.
So you did a rural clinical placement from the University of Queensland, is that correct?
That's right. So in the later half of my postgraduate medical degree, I spent a couple of years at the Rural Clinical School through the University of Queensland, and that was just a great part of the time of life. Often it's people's sort of first experience away from parents and family, and that was mine. So living away from home with some close friends as medical students, and it was a fantastic time of life, studying in a regional area, which at the time was around Central Queensland, Gladstone, Rockhampton sort of area. So that gave me a taste into what it'd be like working and living in a regional area.
So how did Central Queensland become where you are now, Lismore?
Well, after that experience throughout medical school, I was fortunate enough to get my first medical posting in Nambour, which at the time was a regional area, a couple of hours north of Brisbane. So I lived a bit of a regional lifestyle there. But it wasn't until my wife and I went to a friend's wedding on the Gold Coast hinterland, which at the time felt like it was in the middle of nowhere, and we just loved that sort of lifestyle, the country hinterland lifestyle. And we thought to ourselves, where can I get a job in radiation oncology and have this sort of lifestyle? And luckily, Lismore was one of the opportunities that came up at the time.
So I've looked at your pathway to medicine and when you realised you wanted to be a doctor, but did you consider other things besides radiation oncology?
Yeah, I did, Jeff. I did the various medical and surgical terms throughout my internship and junior doctor years. Probably the other specialty that I gave some consideration was in radiology, which is part of our college as well. The radiation oncology faculty and radiology faculty are part of the same college. But I really didn't want to give up the patient contact. And I know within radiology there's some patient contact pathways, but I really wanted to continue the face-to-face everyday patient contact that we get in radiation oncology and be involved in the patient's long-term care and follow-up. And I felt that radiation oncology was the best mix of my interests in anatomy and imaging as well as continuing patient follow-up.
Could you please tell me about the pathway that you took to fellowship? because every training pathway is a little bit different. And then for each person within that training pathway, there's also differences.
Yeah, sure. So after a couple of years working in medicine at Nambour Hospital, where I did some general medical and surgical terms and also some terms in oncology as a resident, I met my initial mentors that inspired me towards radiation oncology. And after deciding that that's what I wanted to do, I applied for the radiation oncology training program and completed 5 years of training throughout the metropolitan Brisbane centres. As part of training there, we also did some work in regional areas, providing outreach services to places like Rockhampton, Hervey Bay, Gladstone, and some others. I'd also done some locum registrar work in Coffs Harbour and Lismore, and I knew the director of the department and I knew the workings of the department. So I was fortunate to get some experience here where I ended up working. And at the end of my 5 years of training, I was trying to organise an overseas fellowship in Canada, like a lot of Australian fellows do. And at the time, we found out we were going to have triplet babies. So we quickly worked out that we couldn't go to Canada anymore and we needed to find a job as quickly as possible and locally. And luckily, because I knew the director down here and the job came up, I was fortunate to get a job in Lismore, and that was 10 years ago.
So what type of radiation oncology can you do in Australia, and in what type of settings?
So it's quite a versatile role. There are quite a few private practices coming online now, so you can practice either publicly or privately in the private setting. Obviously, you can practice in the metropolitan centres. Most of the larger centres are in the cities, but there's more and more regional cancer centres opening up now, which is great. And then you can either practice as a clinician, so seeing patients day to day, or in the laboratory doing translational research. And also there's clinical research to be done as well. So it allows people with different strengths within that specialty to pursue different areas. There's some radiation oncologists who are more clinically focused and others who are more research focused. We can still be clinical researchers in a regional setting even, and our department has quite a strong track record in research, both collaboratively with other centres, but also from studies we've done within our own department.
How would you describe your own current role?
Well, I'm a clinical radiation oncologist, a generalist, but I do have areas of particular interest. So being in a regional centre, you can't just specialise in one type of cancer like they do in some other centres in the cities. So we have to manage any patient that comes into our department with any problem, which I think is a good thing, having been through all of our training, that we can put these things into practice day to day. So as generalists, we manage most conditions, but we do have subspecialty interests. So within our department, we have specialists who might treat head and neck cancer or lung cancer, and another specialist who would treat prostate cancer or breast cancer. And we do have quite a bit of overlap between the specialists so that we can cover for each other and also get opinions from other colleagues. So my particular areas of interest are in head and neck cancer, lung cancer, skin cancer, upper gastrointestinal tract cancers, and also palliation. We provide a service for both inpatients and outpatients, and we also get to participate in and chair various multidisciplinary meetings and collaborate with colleagues both within our department and also at the metropolitan centres. I think one of the good things about training in a metropolitan site and now working in a regional area is I still have a lot of connections with my mentors and supervisors who trained me, and they're the real gurus of particular cancers in Australia, and I have contacts with them so I can knock on the door or email them and get personal opinions, which I think is great.
So going back to that training that you just mentioned, is there any piece of advice that you received during that period that stuck with you?
Yes, so there's a few, but probably the main one that stuck with me is that although we're very evidence-based focused specialty, there are a lot of areas that are evidence-free zones in oncology patient management. So we need to have very sound principles of oncology management that can be applied in those situations where there is no evidence to guide treatment. So we're always trying to instill in our trainees very sound principles of management that they can use in any situation. Another piece of advice would be to gather all of the relevant clinical information before making any treatment decisions. And another one would be that we need to discuss as many patients as we can in our multidisciplinary meetings so that we can get a consensus opinion from all of our colleagues.
So now you're the Director of Training at Lismore, which means you're guiding other doctors to become radiation oncologists. Tell me a little bit about why you want to take this role on and what that has meant for Lismore as a training site.
Well, I wanted to take the role on because I did have a lot of great supervisors throughout my training, and I felt like I wanted to pay that back by instilling in our trainees some of the skills that I've learnt and knowledge that was shared with me. So 10 years ago, before I started in Lismore, we were not an accredited training department. So before I started the job here, I got the ball rolling and had our site accredited for radiation oncology training. I felt it was a great place to set up a training program because it was going to be a good mix of seeing enough patients, seeing enough case mix of different cancers, but also not so much that it was just all service driven, that the trainees would have adequate time to learn and fulfill their training requirements. So some of the centres I trained in Brisbane were particularly busy, which was great from the point of view of seeing lots of different cancers, and I would never give away that experience. But I felt Lismore had the opportunity to become a great training centre because we didn't have a very heavy caseload, clinical load at the time, so that trainees would have a better training experience overall.
You have a very multifaceted role. What's the best thing about doing what you do?
Well, probably the number one thing, the best thing about being radiation oncologists, particularly in a regional area, is being heavily involved in our patient lives, so especially country patients. I really enjoy looking after our country patients because it's a place where you can live and work and you really feel like you're contributing to your community. I actually quite enjoy seeing my patients out and about in the community outside of the hospital, not trying to avoid them like maybe we'd be doing in the cities. Yeah, so that's, I think, the best part of my role.
Are there any other rewards to your career? And also, what are the main challenges?
Well, I think the biggest reward in our career is the privilege of being able to look after or allowed to look after our patients. And something that probably sums it up well, Jeff, is a few weeks ago seeing a patient on the ward. When only meeting them for about 5 minutes, they say to me, "My life's in your hands, doctor." And it's sort of a great honour that after only a short time, the patient, feels a rapport with the doctor and says that they trust you with their life. So I think that's probably sums it up as the greatest reward of being an oncologist and radiation
And
oncologist.
quite a responsibility.
Yeah, sure. So with that responsibility obviously comes some challenges, and probably the biggest challenge is burnout, not just working regionally, but that would be working anywhere as an oncologist. But there are things that, being in a regional area, I've been able to pursue to help with burnout. So outside of family life or work life, learning new skills, particularly skills that you use in the country like fencing and looking after animals, that's helped keep my sanity and helped me get through the difficult times. Because, in oncology we do see some tragic events. Most of them are expected, but the ones that are totally unexpected or happen without warning is when that can affect us personally, but also all of the staff within the department, because they feel as invested in these patients as I do.
So what advice then do you give to a JMO who's considering a career in your line of work?
So I think they still need to have a good background in general medicine and general surgery, because we are quite a specialised training program, so it's good that they have good general medical training before they start oncology training. I think they should also try to attend some oncology clinics and multidisciplinary meetings, and if they can, try and find a mentor like I had, because they can inspire them and lead them along the way. There are also some prerequisites these days, such as basic sciences of oncology courses, and because our specialty is increasing in popularity. A lot of trainees who get onto the program now have done an accredited year or two, and most have done some sort of research before applying to train on the pathway.
If you were talking to a wide group of medical students who are unsure of what career path to choose, what advice would you give to them?
I think it would be to try as many different things as they could and not to exclude any particular areas too soon, and that they should talk to the doctors and the staff within that specialty about their decision and where they've ended up and what they like about it and what they don't, and also to find a specialty to suit their personality strengths.
Dr. Patrick Dwyer, radiation oncologist based at Lismore Hospital.
Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.